Greetings everyone. Today's topic is a health condition that affects millions worldwide: diabetes. Imagine a crowd so large it could fill countless stadiums, a number so vast it's almost inconceivable. This is the reality of diabetes, a health condition that, as we speak, affects more than 400 million people globally. That's roughly equivalent to the entire population of South America, give or take a few million. But what is diabetes? In the simplest terms, it's a condition that affects how your body turns food into energy. Most of the food we eat is broken down into glucose and released into our bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key, letting the glucose into your body's cells for use as energy. But with diabetes, this system doesn't work as it should. There are different types of diabetes: type 1, type 2, and gestational diabetes. But they all involve a problem with the body's ability to produce or use insulin effectively. Left unmanaged, diabetes can lead to serious health complications like heart disease, stroke, kidney disease, and even loss of vision. But here's the thing. While diabetes is a serious condition, it's not a death sentence. Yes, it's prevalent, and yes, it can be scary, but with the right tools and information, it can be managed effectively. As we peel back the layers of this complex condition, we'll delve into its causes and symptoms, its impact on daily life, and the various ways it can be diagnosed and treated. Moreover, we'll share practical tips for managing diabetes, introduce you to beneficial products, and hear from some experts in the field. Our journey into understanding diabetes is not just about facts and figures, it's about empowering each one of us to live healthier, fuller lives, regardless of the health challenges we may face. With such a vast number of people affected, it's crucial to understand what diabetes is and how it manifests. So, what causes diabetes and what symptoms might you experience? Diabetes is a complex health condition, and its origin can be traced back to a multitude of factors. There are two primary types of diabetes: type 1 and type 2. Let's start with type 1 diabetes. This is an autoimmune condition, which means your body's immune system mistakenly attacks and destroys the insulin-producing cells in your pancreas. The exact cause of this immune reaction is still a mystery, but it's believed that a combination of genetic susceptibility and environmental factors may play a role. On the other hand, type 2 diabetes is more common and is primarily caused by insulin resistance. This happens when your body isn't able to use insulin effectively, causing your blood sugar levels to rise. Several factors may contribute to the development of type 2 diabetes, including being overweight, leading a sedentary lifestyle, and having a diet high in processed foods and sugars. Certain genetic and environmental factors, as well as issues like gestational diabetes or polycystic ovary syndrome, can also increase your risk of developing this condition. Now let's talk about symptoms. It's important to remember that these symptoms can be subtle and may develop gradually, which is why many people don't realize they have diabetes until complications arise. Common symptoms for both types of diabetes include frequent urination, increased thirst and hunger, unexplained weight loss, fatigue, blurred vision, and slow healing sores. For type 1 diabetes, these symptoms can appear suddenly and be quite severe. In the case of type 2 diabetes, you might also experience symptoms like frequent infections, areas of darkened skin, and the presence of acanthosis nigricans, which are dark, velvety patches of skin. Remember, these symptoms can vary from person to person, and just because you have one or more of these symptoms doesn't necessarily mean you have diabetes. However, if you're experiencing any of these symptoms, it's crucial to seek medical attention. Early detection is key, and being aware of these symptoms can lead to a timely diagnosis. Diabetes isn't just a medical condition, it significantly impacts one's daily life. When we talk about diabetes, we often focus on the physical aspects, the blood sugar levels, the insulin injections, and so on. But it's equally important to consider how this chronic condition can shape one's day-to-day life. Imagine waking up each day, and the first thing you do is check your blood sugar levels. You have to be mindful of what you eat, how much you eat, and when you eat. Dietary restrictions become a part of your routine. You are constantly balancing your meals with your medication to ensure that your blood sugar levels stay stable. It's a delicate dance, one that requires discipline and constant vigilance. Then there's the need for regular medication. Insulin injections or oral medication, whatever your treatment plan may be, it becomes a non-negotiable part of your daily routine. You're not just managing a condition, you're juggling schedules, prescriptions, and doctor's appointments. The potential complications are another factor that can't be ignored. Diabetes can affect various parts of the body, including the heart, kidneys, eyes, and nerves. This means regular checkups and tests to monitor your overall health. It's not just about managing diabetes, it's about preventing other potential health issues. But let's not forget about the emotional impact. The constant monitoring, the fear of complications, the strain it can put on relationships, it can be overwhelming. It's a psychological battle that's fought alongside the physical one. Yet it's not all doom and gloom. Yes, diabetes presents challenges, but it doesn't mean you can't lead a fulfilling life. It's about learning to manage the condition effectively, finding a routine that works for you, and getting the support you need. It's about taking control of your health, rather than letting the condition control you. There are countless individuals out there who are not just living with diabetes but thriving. They're running marathons, climbing mountains, and achieving their dreams. They're proof that while diabetes is a part of their life, it doesn't define them. Despite these challenges, many individuals live full lives by effectively managing their condition. So remember, you're not alone in this journey. There's a whole community out there ready to support and inspire you. Once suspected, how do doctors diagnose diabetes and what treatment options are available? To diagnose diabetes, healthcare professionals commonly use a variety of tests. The fasting plasma glucose test, for instance, measures your blood sugar after an overnight fast. The oral glucose tolerance test, on the other hand, checks your blood glucose levels before and 2 hours after you drink a special sweet drink. The random plasma glucose test, as the name suggests, is done at any time of the day. Another common test is the hemoglobin A1C, which provides an average of your blood glucose over the past 2 to 3 months. Once a diabetes diagnosis is confirmed, it's time to explore treatment options. Conventional treatments for diabetes typically involve medication, insulin therapy, and lifestyle changes. Medications help manage blood glucose levels and may include oral drugs or injectable medicines. Insulin therapy, often necessary for type 1 diabetes, involves injecting insulin to regulate blood sugar levels. Lifestyle changes are a crucial part of managing diabetes. This includes regular physical activity, a balanced diet, and maintaining a healthy weight. Remember, managing diabetes is not just about lowering high blood sugar, but also preventing it from getting too low. In addition to conventional methods, alternative approaches to diabetes management are gaining recognition. These include acupuncture, biofeedback, and guided imagery. However, it's important to note that while these methods can complement conventional treatments, they should not replace them. To further manage diabetes, continuous glucose monitoring systems are now available. These devices provide real-time glucose readings and trend information, allowing for more precise treatment adjustments. Lastly, let's not forget mental health. Living with diabetes can be challenging, and it's okay to seek help. Mental health professionals can provide support and teach coping strategies to manage stress and improve quality of life. Remember, the right treatment plan can only be determined by a healthcare professional. It's important to have regular checkups and to openly discuss your symptoms, concerns, and lifestyle with your healthcare provider. They can guide you towards the most effective treatment plan for your unique situation. There are ways to manage diabetes effectively. Let's go through some practical tips. First and foremost, lifestyle modifications can play a crucial role in managing diabetes. It's not just about medication, but also about the choices you make every day. Adopting a balanced diet is one of the most effective ways to control blood sugar levels. Try to include a variety of nutrient-dense foods in your diet, such as whole grains, lean proteins, fruits, and vegetables. Remember, moderation is key. Alongside proper nutrition, regular physical activity is equally important. Exercise can help your body use insulin more efficiently, thus lowering your blood sugar. It can be as simple as a brisk walk around the block or a few minutes of yoga in the morning. The goal is to make movement a part of your daily routine. Self-care strategies are another important aspect to consider. Regularly monitoring your blood sugar levels can help you understand how different foods, activities, and even stress can affect your diabetes. Be mindful of your body and pay attention to any changes or symptoms that may indicate your blood sugar is too high or too low. Moreover, maintaining a healthy weight can significantly reduce the risk of complications associated with diabetes. If you're overweight, even a modest weight loss can have a positive impact on your blood sugar control. Remember to also prioritize mental health. Living with a chronic condition like diabetes can be stressful, and stress can affect your blood sugar levels. So find healthy ways to cope with stress, be it through meditation, reading, or even a hobby you enjoy. Lastly, regular checkups with your healthcare provider are essential. They can provide personalized advice, adjust your treatment plan if necessary, and help you stay on top of any potential complications. Managing diabetes is about more than just controlling blood sugar levels. It's about leading a healthy lifestyle, being proactive about your health, and making conscious choices every day. Implementing these changes can significantly help in managing diabetes. There are also products available that can aid in managing diabetes. Now let's talk about some of these products. First, we have glucose monitors. These handy devices allow you to check your blood sugar levels at home, at work, or on the go. They're compact, easy to use, and provide instant readings. Next, we have diabetic-friendly socks. They're designed to provide maximum comfort, promote circulation, and prevent foot injuries, which are common concerns for those managing diabetes. We also recommend diabetic cookbooks. These are full of delicious, healthy recipes tailored to help you maintain balanced blood sugar levels and a nutritious diet. Lastly, there are exercise equipment options like resistance bands and yoga mats that can support regular physical activity, an important part of managing this condition. Please note, while these products can aid your management of diabetes, they're not replacements for professional medical advice or treatment. Always consult a healthcare professional before trying any new products. Hearing from those who deal with diabetes firsthand can provide a different perspective. Let's dive into the wisdom of professionals who manage diabetes daily, and individuals who are navigating their journey with this health condition. Dr. Sarah Thompson, an endocrinologist, shares her perspective. Diabetes is not just about managing your sugar levels. It's a holistic approach that involves diet, exercise, stress management, and regular monitoring. It's about understanding your body and making lifestyle adjustments accordingly. Next, we hear from a diabetes educator, Mark Roberts, who emphasizes, education is key. Understanding the disease, its triggers, and how it affects your body can empower you to make informed decisions. It's my job to equip people with the knowledge they need to manage their diabetes effectively. Now, moving from the professional sphere to the personal, let's hear from those who live with diabetes day in and day out. Rachel, a type 1 diabetic, shares her story. I was diagnosed when I was 10. It was a shock, but I learned to adapt. I'm not defined by my diabetes, I just have to plan a bit more. I check my blood sugar levels, I count my carbs, and I stay active. It's my normal now. John, who has type 2 diabetes, tells us, I had to make some serious lifestyle changes. I've lost weight, I exercise daily, and I've learned to cook healthier meals. It's a journey, but I feel better now than I did before my diagnosis. From these insights, we can see that diabetes is not a one-size-fits-all condition. It requires individualized approaches, personal resilience, and a solid support system. It's about more than just managing sugar levels. It's about managing life in a way that supports overall health and well-being. Remember, these are personal experiences and should not substitute professional medical advice. Always consult with healthcare professionals for personalized guidance. These insights underline the reality of living with diabetes. Diabetes is a lifelong condition, but it doesn't have to limit your life. As we wrap up our discussion today, let's revisit the key points we've covered. Diabetes, a prevalent health condition, comes with its set of challenges. It's caused by various factors and exhibits a range of symptoms, from frequent urination to unexplained weight loss. But remember, the presence of these symptoms doesn't necessarily mean you have diabetes. They're only red flags that should prompt you to seek medical advice. And that's the first step, getting a proper diagnosis. With advancements in medical science, diagnosing diabetes has become more accurate and straightforward than ever. Once diagnosed, managing diabetes is the next crucial step. It's not just about taking prescribed medication, it's also about making lifestyle changes. Eating a balanced diet, exercising regularly, and maintaining a healthy weight can significantly improve your health and keep your blood sugar levels in check. And then, there are products specifically designed to aid diabetes management. From glucose monitors to diabetic-friendly foods, these products can make a significant difference in your daily life. But remember, not all products are created equal. It's essential to do your research and consult your healthcare provider before trying anything new. We've also heard from experts in the field and individuals who've walked this journey, sharing their insights and personal experiences. Their stories emphasize that while diabetes is a challenging condition, it's not insurmountable. Finally, don't forget the wealth of resources available to you. Support groups, online communities, and various other platforms can provide additional help and information. But at the end of the day, the most critical piece of advice is this: seek professional guidance. Every individual is unique, and what works for one might not work for another. Personalized advice from healthcare professionals is invaluable in managing diabetes effectively. Remember, it's essential to consult healthcare professionals before trying any new treatments or products. Stay healthy, stay informed.